Atlas standard is a method of eliminating displacement of the atlas first cervical vertebra. The position of the first cervical vertebra, the atlas, affects the functioning of the entire body. Atlas standard is a reliable and effective method of correcting the position of the atlas, developed in Switzerland. In most cases, one treatment and a follow-up visit to an atlas specialist is sufficient. The atlas is the first cervical vertebra that holds the head on top of it. It was named after the mighty Atlas, the hero of ancient Greek myths, who had to hold the heavenly dome on his shoulders. Atlas's movable connections to the skull allow us to tilt our head forward and backward with ease. The movable connections of the atlas to the second cervical vertebra axis allows us to turn our head with ease. In doing so, the second cervical vertebra is the axis of head rotation, hence its name axis meaning axis. Very often the displacement of the atlas relative to the skull is detected. In this case, the atlas takes an oblique and twisted position relative to the head. This is usually caused by trauma, such as whiplash in a traffic accident, where the head is whiplashed back and forth, or a baby falling from a crib onto your head, or falls at work and sports. But the most common injury is a dislocation of the atlas during childbirth, when the neck and head are subjected to squeezing and twisting. This results in malpositioning of the atlas. From birth, the incorrect position of the atlas in relation to the skull is fixed by the muscles located in this area. The occipital joint, its ligaments and sheaths, as well as the spinal cord sheaths, muscles and ligaments of the neck are overloaded. As a result of the strain on the muscles and ligamentous structures, the incorrect head position is maintained for life. This misalignment leads over time to many painful manifestations of varying degrees of severity. More often than not, the underlying cause of atlas dislocation remains hidden, and all help is reduced to attempts to alleviate the symptoms. Let's consider the problem in detail. The atlas is closely connected to the vessels that supply blood to the brain. For example, the vertebral artery, it runs in the lateral processes of the upper cervical vertebrae. Then through the atlas, it arcs through it and into the skull. In front of the atlas, the internal carotid artery runs right up to it. The condition of the carotid and vertebral arteries determines the condition of the brain and therefore our lives. Atlas dislocation can lead to compression of the vertebral artery, which restricts blood flow to the brain. Atlas displacement can also lead to compression of the internal carotid artery, which also impairs cerebral blood flow. Atlas misalignment can cause a variety of conditions, from headaches to migraines, from neck pain to stiff neck, from shoulder pain to numbness in the hands, as well as the familiar back pain. It's not just the blood flow to the brain that is impaired by atlas dislocation. It can also damage nerves. Right in front of the atlas is the vagus nerve, one of the most important nerves in the autonomic nervous system, and it's responsible for many of our body's functions. For example, it is responsible for the production of gastric juice and controls the digestive process. If the vagus nerve is compressed by a displaced atlas, it leads to many problems such as dizziness, balance problems, attention deficit disorder, pale or flushed face, sweating, gastritis, nausea, constipation or diarrhea, and irritable bowel symptom. The vagus nerve also affects the regulation of heart rhythm and blood pressure. Damage to this nerve results in a quickening of the heart rate, tachycardia, or a slowing of the heart rate, bradycardia. A dislocation of the atlas results in a misalignment of the head relative to the spine. Our body tries to build itself up to the unnatural position of the head, and by twisting, we develop scoliosis, different shoulder heights, a slanted pelvis, and different leg lengths. All of this leads to negative consequences. Improper weight distribution leads to constant overloading of muscles, compression of nerves and vessels. Frequent knee pain, persistent low back pain can be related to a misaligned atlas, but we don't even realize it. Modern medicine does not pay attention to the displacement of the atlas and its harmful consequences. As a result, patients are often forced to suffer for years without knowing anything about the real cause of their suffering. Atlas displacement, which is detected by CT scans, is most often overlooked by doctors, so pain medications are usually prescribed instead of finding the cause of the problems. The Atlas Standard Method was created in Switzerland. The Atlas Standard procedure is not demonstrated in this movie. To protect patients from amateur attempts to use it, it is difficult for a patient to objectively assess the position of their own atlas. This is often taken advantage of by the various schools of spine treatment by simply relaxing the muscles of the area, but not correcting the atlas misalignment. Some even claim to be able to eliminate atlas displacement by the power of thought. What these techniques have in common is that they must be applied regularly, over and over again. In contrast, the Atlas Standard procedure is usually applied once and the results last a lifetime. It is important to realize that the Atlas Standard Method is not a treatment or diagnostic method and is not intended to treat disease or its symptoms. The Atlas Standard Method helps restore the body's ability to function properly. Atlas Standard helps to identify and eliminate or reduce the displacement of the atlas relative to the skull using a safe and effective technique that has nothing to do with chiropractic methods. If the atlas misalignment is corrected, the body heals itself in most cases. A follow-up appointment is required after the procedure and is not required until at least 1 month after the procedure. To help the process of self-healing, it is necessary to do gymnastics, massage, water procedures, bath, swimming, of course. The results can also depend on the general condition of the person, in what condition he turned for help. Nevertheless, usually our patients note an improvement in the quality of life. Although everyone's victories are individual,